New cases of COVID-19 have peaked in Kern County. That tonight from Public Health. And while that may sound like good news, it's actually not. It means that over the next 2 weeks, hospitals will be inundated with COVID patients. Long wait times can be expected, and even ambulance rides will be prioritized for those in need of intensive care. 17's Christian Galeno has more.
Yeah, well, local hospitals are now implementing emergency surge plans to prioritize health care to those that desperately need intensive care.
Pregnant women, being admitted. We're seeing children in our PICU, some in our regular pediatric department. Again, much younger than what they saw in the past, and I think that has been very difficult on them.
After reporting more than 2,000 positive cases of COVID-19, Kern's infection rate could see a decline, but this is just the calm before the storm.
We anticipate for another 2 weeks to continue to see hospitalizations increase here in Kern County due to COVID-19.
When things get desperate measures follow.
We've been seeing record numbers in our emergency room, and so that means wait times are relatively long in some of our emergency settings at all of our hospitals.
The ERs will take anybody we bring to them. They might just not be able to admit them upstairs to a hospital bed. We're having to do more transfers, also transferring patients out of town or from hospital to hospital, to shuffle the patients to where a bed is available.
Quite frankly, staffing is a challenge every shift.
So we have expanded into non-traditional care places to take care of COVID patients. The reason we've had to do that is because we've seen the number of ICU level care COVID patients roughly double in the last week in Kern County.
Our system is taxed right now, and we need to do everything we can to not take up a hospital bed if we can prevent it.
Well, hospitals also shared that staffing hospital floors with nurses is a bit challenging. Hospitals are resorting to hiring traveling nurses who are charging upwards of $200 to $250 an hour for their services. But even then, these nurses are bouncing from hospital to hospital as they are in high demand, and some hospitals are paying top dollar. Reporting in studio, Christian Galeno, 17 News.